If you ask me about the symptoms and complications of hernia, as discussed, the bedside diagnostic tool to diagnose a hernia is whenever the patient coughs or strains and there is increase in size of the bulge, and if that bulge decreases in size on lying down, it must be a hernia. Next, we'll discuss about what are all the possible complications that can happen in a neglected case of hernia. The two main dangerous complications that can happen are obstruction and strangulation. What happens in a case of obstruction? Just assume this as the hole in the muscle and this fingers as the intestines which are protruding out through the hole in the muscle. In initial stages of hernia, whenever the patient coughs or strains, the intestine tries to go out, and once the pressure is relieved, the intestine tries to come back to its original position. In bit advanced features of hernia, then what happens? The intestine tries to go out and it doesn't come back, but still there is no tightness to such extent that obstruction or strangulation happens. But what happens in more advanced cases, the intestine pushes further into the hernia and thereby the intestine is nothing but a pipe which transmits the food. If this pipe gets obstructed or occluded because of the tightness of the hernia, then patient may develop into an emergency called as obstruction, where patient may develop fully distended abdomen with vomitings and all. Because what might have happened in such condition is the pipe has got blocked and the pipe is getting overflowed from the starting point, which is mouth. So that's why in case of an obstructed hernia, there will be sudden bloating or full distension of the abdomen along with vomitings for the patient, and he or she won't be able to pass stools at all. There is another dangerous and dreadful complication called as strangulation, where, as discussed, if this is the hernia ring and this is the intestine apart from getting blocked from passage of its content, there will be blockage of or there will be cut off of the blood supply to the intestine also in case of a strangulation. Just like if there is a ring that has been densely stuck over the finger, the way this finger gets swollen and edematous, the same thing can happen to the intestines also, resulting in death of the intestine. That complication is called as strangulation, which is a die-hard emergency. So, to prevent all these complications from happening, what we generally suggest in a hernia case is treat the hernia at the earliest, because stitching time saves neck.